Hey, hi everyone. Thank you for joining me today virtually. My name is Dr. Colin Gill. I'm a functional medicine provider with Align Modern Health. And today we're going to be talking about what I like to refer as stubborn weight loss, which most of us think of as weight gain, obesity, or just difficulty losing weight. So allow me to get my PowerPoint deck up here, and then we'll start. All right, awesome. So this presentation, I want to focus on a couple key things for you as an individual who maybe struggles with weight loss yourself, or knows some loved ones who do as well. And this is going to be shared from more of a functional medicine perspective. And just a brief overview of what functional medicine is it's a form of internal medicine that really looks at the body as a whole and seeks to understand the root cause of your symptoms and diseases as well. So when we approach weight loss, and specifically individuals who really have struggled for long periods of time with losing and keeping weight off, it's really important for us to look at the reason why that this might be. And that's what we're really going to be talking about today for about the next 20 to 25 minutes. Here's a slide about me, a little bit of my education, credentialing, and like I said, I'm a functional medicine provider at Align Modern Health at the Southport and Lincoln Park locations. And here's a little bit about an overview of the current obesity epidemic. Now, it's almost half the population in the US, and in Canada, it's over half the population that is either overweight or obese. And on top of this being an issue for the individual, the global burden and healthcare cost burden is really significant. The CDC estimated that in 2008 alone, there are over $147 billion spent on obesity-related medical costs. Obesity and really just increased weight of any proportion will contribute to most diseases. All causes of mortality are actually increased for individuals who are obese, and a host of other concerning conditions and disorders too. So there's a lot of interest, including just personal comfort in your own body, but also interest of staying healthy and living a long, happy life, and not being requiring certain treatments or interventions that working on obesity will really help us towards. So definitely an appropriate thing for us to be talking about really at any point in time, and I'm excited to share a little bit more. So one of the things that I want us to understand from the beginning is there really are two different definitions of obesity and one I'm really going to be using for most of today. There's something that I typically would refer to as weight gain, which is really normal. What weight gain looks like is you go to Thanksgiving, you go to dinner during the holidays, maybe you're eating a little bit more than you might typically, and you're exercising and moving around less. And it's very normal for individuals to gain a few pounds under those circumstances. So that's what I refer to more as weight gain, meaning it's just because you're consuming more than you're spending. That is not always the case though. A lot of individuals suffer from stubborn weight loss, meaning you have tried different diets, you have tried restricting your diet to unhealthy, low amounts of calories and exercising a large amount, and you still don't really notice a budge or a change in the scale. That's really what this talk is about for individuals who've been through that. And we're going to look at some of the different reasons why that may be the case for you. I do want to make sure that we're all on the same page where everyone's different. And a lot of people may suffer from the same symptom, meaning they can't lose an extra 50 pounds of weight no matter what they try. But for each 5 people that maybe suffer from that, there could be 5 completely different reasons why. And there could be 5, that means there are 5 different treatments that each person needs individually that would work for person 1 versus person 3. So with stubborn weight loss, we have to take a personalized approach. A one-size approach will not cut it, not even close. It's going to lead to a lot of struggling for individuals who keep trying a new diet. Again, the one-size approach just doesn't work. So we're going to be going over that in detail today. So excited to share that. When we kind of look at the most common ways individuals try to lose weight, not surprisingly, the 2 at the top are eating less and exercising more. Now, for individuals who have excess weight, like I said before, just because they're eating more than they should and exercising less, this is a really great fix. And for a lot of individuals, this is enough to help them lose weight. It's more so a matter of discipline and maybe learning how to cook and eating the right foods. But that's more weight gain. We're really going to be focusing on what about all the other individuals who've already tried this, who just still struggle with weight loss? What is the reason for that? All right, so it's really important, again, to understand that struggling with this stubborn weight loss is not a disease. It's nothing that there's a specific treatment for. It's a symptom of something else causing it, meaning it's a sign that there's another imbalance in your body, whether it be hormonal or due to other issues that we're going to go into shortly, that is showing itself being a symptom of really difficulty losing weight. So we want to focus on what's underlying and causing this symptom of stubborn weight loss and not just trying to treat the weight loss itself. And we're going to approach this kind of like I said, from looking for the root cause, why this occurs. And this is what functional medicine does for really every patient. I see patients with a whole host of different symptoms, from fatigue to gastrointestinal issues to mood disorders as well. And we're always asking the same question, not how can we cover up your symptoms, but why are your symptoms occurring and what imbalances may there be and how can we investigate and really find out what's going on. So we're really going to be focusing on stubborn weight loss, and the next few slides are going to help us understand a lot of the most common reasons why individuals will suffer from stubborn weight loss and some of the symptoms that you might notice. And then towards the end, we're going to talk about what we can do about that and how we can get you feeling better and losing some weight as well, hopefully. All right. So when we look at weight gain or stubborn weight loss, for your body to accumulate fat tissue, there are really two things that can happen, two different patterns of this. One, your body may be storing more energy as fat tissue. That's more so where we see thyroid disorders. But sometimes your body, the signaling in your body and your metabolism is a little bit off. And your body will take more of your energy that should be going to your brain and keeping you alert and feeling good and mood-wise and just really feeling great. It'll take a lot of that energy and siphon it and really kind of funnel it into fat cells. There are a lot of different reasons why that happens, thyroid disorders being one of the most common. So that's the first reason you might have more weight than you want. It's an issue of storage, where your body's taking excess energy and for some reason it's putting it more into the fat cells. The second reason, actually, I'm finding it's a little bit more common, and it's what I like to call fat blocking. But essentially, the energy that's stored within fat cells, like all those like high energy molecules that your body needs for fuel, they have a hard time getting out of the fat cells. They actually are kind of stuck in the fat cells. So any weight that you accumulate is more or less going to stay in the fat cells unless the reason why you have this kind of fat blocking situation going on is taken care of. So a classic example of this is for people who have high levels of inflammation. What that literally does to your body is it signals to the fat cells to keep all the contents within them until the stress and the inflammation is taken care of. We're going to go into what causes inflammation in a little bit here, but really, really important to understand that this is an incredibly common cause of why individuals can eat very little and exercise a lot and notice no change in weight on the scale. It's because their body is literally not allowing the fat cells to release their contents and to decrease their size. So looking at thyroid disorders, especially in women, these are some of the most common hormonal disorders that will cause weight gain. There are a lot of symptoms between all these conditions that are shared, but with thyroid issues, we're looking at really low energy, hair loss, and then mood disorders, cold hands and cold feet, and a lot of difficulty losing weight. Usually these symptoms can progress over years and years, and it can be a 10+ year process where these symptoms start to occur. So again, when you don't have a thyroid that's functioning well, what's going on is the thyroid is supposed to make something called thyroid hormone. Thyroid hormone is needed for every single cell to activate. Just like turning your car on every morning, you have to turn the key to basically turn on the engine, which is going to pump gas to the engine and make combustion and get your car moving. Your cells are the same way. They need thyroid hormone, which is like the key to turn on the cell's engine and to basically drive normal metabolism, which will use up your fuel. If that's not occurring, your body's going to have a lot of excess fuel, i.e. gas in this analogy, that it doesn't know what to do with. So it puts it into storage. So again, this is probably the most common cause in women of stubborn weight loss, and a really, really common one I see in my practice quite a bit. The other one that we mentioned briefly before is chronic inflammation. Now, inflammation is anything that causes your body's immune system to be on guard. So typically when we feel ill, if you have the sniffles or if you have an upper respiratory infection, your body will go through a brief 1 to 2 week period of inflammation. And that's normal, and it's really necessary in short periods of time to get rid of whatever microorganism, i.e. a bacteria or a virus that may be attacking you. For other individuals, though, they struggle with chronic inflammation where this inflammatory response is really going on for a long time and it's self-perpetuating. That will keep your body in this kind of stressed out fight or flight mode where your body thinks that you're still being affected and being attacked by something, whether it's a bacteria or a virus. And when your body is inflamed, one of the main things that happens is your metabolism is really interrupted. And like I mentioned before, your fat cells literally are told to hold on to their contents, and they don't really release any energy into your body. So people can have low amounts of chronic inflammation, and as this picture shows, very, very high amounts too. And the only way to know is to do a lab test, a couple lab tests that can look at this for us. And there are a lot of different symptoms. These are 5 out of probably 40 that we could come up with. But chronic inflammation, you know, we've got to, if you're somebody where you suspect this might be you, it's really important to work with a provider who understands how to assess this and to assess why the inflammation is there as well. It can be due to lifestyle, like poor sleep, poor diet, high stress, and lots of other things as well. But this is another very common cause of stubborn weight loss, something I see quite frequently in my practice. Another common one are gastrointestinal imbalances. We've probably all had these at some point in our lives. When an individual experiences these, typically the common symptoms are changes in bowel movements, gas and bloating. You may even notice some skin changes, so some skin rashes. You may struggle from low energy and sugar cravings. But another really common symptom of gastrointestinal imbalances is stubborn weight loss as well. And what's going on here is chronic gastrointestinal disorders and symptoms can cause a lot of inflammation as well. So those will lead to weight gain and even some water retention. So some individuals will have an increased body weight, but it's not always from fat cells. There can actually be excess water that's being stored in your body as well as a result of inflammation. All right, another very common one are hormonal imbalances. Now these affect men and women. And many of us may think of the hormone estrogen, which is a kind of fat-promoting hormone, but there are many, many other hormones in both the male and female bodies that can contribute to weight gain or stubborn weight loss. So estrogen is one, but what hormones will typically do is they will signal to cells for lots of different things. Any one hormone may have 100 different functions that it kind of makes occur. But many hormones, one of the things that they do is they will tell fat cells to replicate and to increase the amount of fat that's in them. So that's fine and normal and needed for healthy life and metabolism. But when we have imbalances where you have really high levels of some hormones or really low levels, that's where things become imbalanced and you may struggle from really stubborn weight loss or really any of these other symptoms as a result of a hormonal imbalance. Again, these are very common in both men and women. There are quite a few hormones that can cause this, so it's very important to do testing with a provider who's comfortable with these issues to really understand exactly what hormones may be imbalanced and why that may occur. Really common symptoms of this are low libido, low energy, mood changes and irritability, and then fertility challenges for both men and women, and of course, difficulty losing weight. Now with these, a little tip with these is typically the weight gain will be more around the hips or the buttocks region, and maybe not around the whole body that you could see with other disorders. Okay, another one that we are unfortunately very, very familiar with as a country right now is chronic stress. With the advent of work from home and just having more stressful home environments where home is now a school and a workplace and a place for relaxation, chronic stress is definitely on the rise. What stress does is it releases a hormone called cortisol. And cortisol will also, like other hormones, will signal your fat cells to increase in number and to really increase the amount of fat that they store within them. So again, normal amounts of cortisol are healthy and we really need it for our bodies to function well. But when your body has too much cortisol, that's when it becomes an issue. And acute issues of stress where maybe your car breaks down and you have a couple of days where you feel a little bit more agitated and wired, that's very normal, that's no concern at all for long-term health. However, if you're in a job or a home environment that constantly is really driving your stress response and your levels of cortisol are skyrocketing, that's when we really run into issues. Some really common symptoms of this are difficulty sleeping. Now, that could be either falling asleep or staying asleep. Salt and sugar cravings, irritability, low energy or fatigue. Dependence on caffeine is a really common one because caffeine will help give us that little bump to get through the day. But also stubborn weight loss, very, very common symptom of chronic stress disorders as well. So that's kind of the overview of some of the most common reasons I see in my practice right now that individuals are suffering and struggling from this weight loss resistance or stubborn weight loss. So I think the natural question comes up, okay, that's really helpful information. Where do we go from here and how do I apply that information? I hope that what this has helped you realize is there are a lot of different reasons, a lot of similar symptoms occur. So if you have low energy and you have stubborn weight loss, as you just seen, there are about 5 and many more potential reasons for why that can occur. So it's really important to work with a provider. And in this context, I would say functional medicine providers are going to give you the most holistic and kind of macroscopic view of why you might struggle with weight loss. But really important to work with a provider who is able to take a thorough history and physical examination and do some thorough testing that can really help them triangulate where your body might need support and which pattern that you might fall into that explains your stubborn weight loss. So that's what we're here for. Like I said before, functional medicine does provide a really great big picture view of your body. We don't just look at one lab marker, maybe just assume it's thyroid. We look at really all different ways that the body can go be imbalanced and try to find which those are and pinpoint a really specific treatment plan. So our approach is, first and foremost, understanding what imbalance is going on. And that's so crucial. No matter who you work with, understanding the why of your symptoms is absolutely essential. Once we know why your symptoms are occurring, and in this instance, stubborn weight loss, treatment becomes a lot easier. Now, this is not promising treatment results, and this is not promising your treatment plan is going to be perfect, but it becomes so much easier when you understand why you're experiencing these symptoms. And the treatment should really consist of quite a few things. It should consist of dietary changes, absolutely. Now, fad diets like the ketogenic diet or the paleo diet or Whole30 diet may or may not be good for you. Those are not necessarily bad or good diets. Again, it really just depends on the individual. But dietary changes are really important. Nutritional supplementation if you have certain micronutrient deficiencies, or if you are somebody who has one of the disorders we spoke about, you may require some extra support to help get your body back on track. And then the third thing is exercise recommendations. Now, exercise recommendations, there are a lot of different ways that we can exercise and different ways for different people. So again, I'm not going to give you a specific diet or a supplement or an exercise to do today. I'm just going to kind of empower you to get some answers as to why your weight loss may not be moving the way that you want. So these are all important aspects of a treatment plan, but the most important thing is that it be personalized to your physiology and to what your body needs. So that's all I have to share today. I want to thank you so much for joining me virtually here. And I'd encourage you, if you're interested in this and finding out more information, you can give us a call on the number on the screen, or you can visit our website and you can schedule a free 15-minute consultation with either myself or some of our other providers. This can be in person or over telemedicine. And that's a really great way to feel if this may be a good treatment approach for you. So again, I want to thank you all for joining me so much, and I hope that this was helpful and informative. So enjoy your holidays.